Thank you everybody for having us here today. It's an incredibly humbling experience to be a part of this amazing campaign, and we're just going to take 10 minutes to maybe just shift the tone a little and just take some time to think about you and to think about the people in your life that may need a bit of extra support if they're struggling. Are You OK? We were founded in 2009 by a gentleman by the name of Gavin Larkin. Gavin Larkin was an advertising executive whose father took his own life when he was young. Are You OK? At its core is a suicide prevention charity, but we encourage everyone to look out for those around them, to support people through life's ups and downs. And so during the presentation today, there will be reference to suicide and suicide prevention. And I just really want everyone to feel comfortable that if that triggers anything for you, then please feel free to step outside, take a walk. Perhaps see myself and my colleagues, Christina and Ruth, who are here today. It's absolutely fine if you need to do that. In Australia, suicide is sadly a leading cause of death. And last year there were 3,027 people who took their lives. 75% of those were men. It's an incredibly complex and significant social and health issue that requires a multifaceted response from community and us as help givers. We work with other organisations in the mental health and suicide prevention sector, but what Are You OK does is our main point of difference is that we absolutely remain really concentrated on the fact of having regular, meaningful conversations. What we're trying to do is to try to get in early, spot when somebody needs some help, and try to avoid a crisis. Gavin said that in the time it takes to have a coffee, you can start a conversation that can change a life. We're encouraging people to understand that you don't have to be an expert to help someone who may need a bit of extra support. You don't need to be a psychologist, you don't need to have any particular training. We've all got what it takes to support someone. For most of us, we have our eyes to spot some signs that something's wrong. We have our mouths to help them encourage some action, to find them some ways to help lighten that load. And we also can have some time to check in with them and see how they're going and be with them on that journey. We're inspiring people to take the time to ask, are you okay? And to listen. It's incredibly important to listen. Trying to listen with an open mind with what they have to say. It comes down to regular face-to-face conversations about life. Our theory is based on a US academics evidence to show that belongingness is one of the most significant protective factors for our social well-being, our mental health, and protecting against suicide. If you can enhance an individual's sense of belonging, then you can hopefully help to reduce that likelihood of suicide. And it's that piece of connection and bringing down barriers that we seek to enhance. We promote and empower peer-to-peer support. So I'm really here today to ask you to think about perhaps a family member, a friend, a colleague, or a neighbour who you think might just be in need of a bit of extra connection and a bit of support. It's such a multifaceted approach to suicide prevention, and that peer-to-peer support is where we absolutely focus on. Our target audience is not the person who's struggling with life, it's actually those people around them. So it's us in this room, it's about friends, as I mentioned, community members. It's also about healthcare providers, it's about your GP, and we're trying to point people to a direction of trying to find the best help for them. Some of you may wonder where we sit in the mental health sector. And as I said earlier, we're about getting in early. We're about starting those conversations when we spot it may be needed. So we sit at the bottom here in the self-care, informal community care space. Sometimes the conversation can and may be too big for you or I. It can be too big for friends and family to help. And that's where we can have a think about, we can encourage some action. Have you thought about seeing a GP lately? Have you thought about talking to your manager about this? Is there anyone else in your family that you can talk to? Have you had a think about calling Lifeline for a confidential chat to get it off your chest with someone who's not going to judge you? We're all about the 4 steps to a conversation, and that's our focus for our campaign for this year. Are You OK comes up in September. And we're really focusing on these 4 steps. This is where we're trying to empower and encourage you all to know that you do have what it takes. It's about asking, are you okay? Listening, encouraging that action to help them manage the load, and checking in again. Because if you've asked and you've taken the time to listen and they've actually shared with you what's going on, then to be really genuine and follow up and show that you care, check in with them again soon. Ask them how that appointment went. Ask them how they're travelling now. Let them know that you're there. Our activation for this year, which is something that we wanted to share with you, is our Conversation Convoy. So kicking off on the 1st of August in Uluru, we're going to be travelling around the country in 4 vehicles. Each vehicle represents one of those 4 steps. And we'll be travelling across 21 communities across 6 weeks in the lead up to Are You OK Day, where we finish in Cairns. In every location, there'll be an event where we're hoping to invite as many community members down as we can, as many people from the mental health and suicide prevention services as well to join us, and to be able to showcase what's available in the local community. These are the communities that we'll be travelling through. We're a very small team. We've got a few extra crew members on board that are going to help us get around. And we've also got an amazing wealth of community ambassadors who train with us and who go out there and help spread the message. For more information on some of the locations that we'll be going through, you can see the New South Wales leg here. We'd love for as many of you to join us as possible. If you're interested, come and see us and we can give you some more details about where we'll be. At every location, there'll be some entertainment, there'll be some presentations, and there'll be some activations around how you can find the skills to have an Are You OK conversation. Because of the time constraints of this presentation, I haven't gone into how to ask, how to have an Are You OK conversation, but that's all available from our website and from seeing us here today, and really would very much welcome having a chat with each of you if you need some tips on how to get the conversation started. In one of the cars, we're going to have a dash cam to showcase some carpool conversations where we're going to hear from real people about how a conversation changed their life. And we work very much with Reach Out, Beyond Blue, Lifeline, and the Centre for Rural and Remote Mental Health will be joining us on the convoy. They're bringing the 5th vehicle along to showcase what's available in the area. Whenever we visit a location, we'll be leaving a conversation bench, which we hope will encourage more conversations once we've left. Our campaigns are very much about a multifaceted approach. It's about certainly about developing campaigns that speak to each of our diverse audiences. And so throughout the year, it's not just about Are You OK Day in September. We run campaigns every day of the year. We have our work campaign, schools. We're about to launch a new university for students, for those who just maybe be able to spot that fellow students are struggling during that time. We have our field campaign for fly-in, fly-out workers. We have a campaign for those in law and the stresses that that brings. And we also have a whole campaign centred around the rail industry. Sadly, the rail industry, as you would imagine, sees some tragic incidences, and it's all about the rail industry coming together and supporting their mates who are witnessing those events. We have developed a new resource called the Mateship Manual. It's been created in response to suicide rates in rural communities, particularly for men, and it aims to inspire and empower mates on the land to support one another. As you would know, the hardships of living rurally can include stresses such as financial insecurity, the environmental changes and isolation, and access issues. And what we're trying to do is to help you know that it doesn't have to be for someone to be in crisis. They don't have to be feeling suicidal for you to be able to reach out and have a chat with them. We all go through life's ups and downs. We all go through grief. It may be a relationship breakup, work stress. It's about having and trusting that gut instinct if you think that something may be wrong. We're trying to promote the long-term behavioural change so we can save lives now and well into the future. Hence why our schools program is talking to younger children so that we can help to have that generational change. The Mateship Manual helps to provide a tool. So it's not telling you how to speak to the people that you know. We can't do that, but we can give you some tips. For example, if somebody's not returning calls, if they're not turning up to things, they just don't see themselves. Perhaps find a way to go round and ask to borrow something. Perhaps try to have a chat while you're doing something so you don't have to make that eye contact if they feel uncomfortable. Tips like that might be able to help get the message out there. We're working with RAMP and the Centre for Rural and Remote Health to try to get this menu out as far and wide as we can. And it actually started from a donation with the sale of Bongongo studs to Are You OK? And we received some funding from a variety of different foundations to help us get this out there. That's a really short insight into what we do. I hope that you can have a think about someone in your life. And as I said, we're around to have a bit more of a chat later.